As Loudoun County students are phased back into school for hybrid learning, we're taking a closer look at CDC guidelines for reopening and how teachers feel about safety. Sharon Roget standing by tonight. She is here with more.
Yeah, Jim, last Friday, the CDC put out a 5 mitigation strategy plan, all based on science and research to curb the spread of COVID-19 on school campuses. The top two included universal mask wearing, of course, physical distancing, keeping kids 6 feet apart. But there's so much more involved. I spoke with Dr. John Brooks of the CDC to get some more insight.
We also recommend that there be in place a system to rapidly diagnose children who are infected so that they can be taken away from the school. Then contact tracing can occur, identify kids who've either been infected or have been exposed, and actively quarantine them. So another thing that is important to consider, but I know can be a challenge for some schools, is ventilation. We know that simply cracking a door, cracking a window can bring in fresh air, and that fresh air dilutes and moves on air that may be containing virus. To the same extent, some schools are using a screening testing strategy. Now, a diagnostic strategy means I test a kid and they're symptomatic, or I think they might have it. Whereas screening is you have a system to regularly test children on a scheduled basis.
Dr. Brooks says cleaning is also important. While schools are generally cleaned daily, the CDC recommends cleaning the high-touch surfaces to reduce transmission. He says layering these interventions is what will ultimately lead to success when it comes to safety. Now, I spoke with Sandy Sullivan. She's the Loudoun Education Association president, for her perspective as schools start to reopen.
Do you feel like the CDC guidelines put out for school reopenings are enough to keep everyone safe?
Well, I think if those guidelines can be followed, then that does put us in a safe place. It's just in Loudoun, we're not positive that all of those things are happening with fidelity.
Is there something that needs to be done to make sure that these guidelines are followed properly?
Well, social distancing is a challenge in some classes, as you're aware. It's just, hard for educators to stay away from students. They need to be hands-on and assisting students throughout the day. Another big issue is the cleaning protocols. The cleaning agent that's used requires 10 minutes of the product on the surfaces without students in the room before they're wiped down. And some schedules aren't in place that allow for that. Loudoun has a anonymous reporting form that can be filled out when an educator has a concern, but there's nothing in place that the school system can regularly collect data.
Yeah, Loudoun County has a daily symptom checker for staff and students, but Sullivan is pushing for a daily report that teachers can put out to document if these mitigation efforts were actually being able to be followed. She also says most teachers are eager to get back in the classroom, and they do plan, at least in Loudoun County, to get vaccinated. Angie?